Good morning and welcome to Senior Circuit. A little different this month. We're trying to do it in social distancing. As you'll see, we're all in each of our homes. And I want to welcome my guest today, who is my staff. First, we'll start with Ashley. Ashley Speliotis is one of our social workers. Welcome, Ashley. We'll get right back to you.
Yes.
And then we have Natasha Niam. Natasha is one of our other social workers. Welcome, Natasha. Christopher Kabalowski. He's in the middle square. He's our health and wellness coordinator. And then on the far right bottom is, I'm looking at, is Debbie Higgins, who is our outreach coordinator. Thank you all for being here. Debbie, thank you. Welcome.
Thank you.
Thank you.
So first, I'd like to start with introducing you to the staff and let them say a little bit about themselves and what they do. This has really been a challenging time for all of us, and we wanted to reach out to you and let you know that we're still here. We're working. We're part of your family and part of your home. So, we hope this session will be an opportunity where we allow folks to ask us questions, and we're trying to answer those questions. We're getting so many calls. So, Ashley, I'm going to start with you. And if you want to introduce yourself again and how long you've been with us, what do you do at the Council on Aging, and what's your specialty up there, and then we'll move along to the next person.
Okay. Like you said, my name is Ashley Speliotis. I'm one of the social workers here. I run different groups at the Council on Aging, like caregivers groups and our memory cafe for folks with cognitive decline or concerns. And we also do, Natasha and I, a lot of one-on-one counseling for different programs and different benefits outreach.
Thank you. Great. We have a great social work team. Natasha, want to tell us a little bit about yourself?
Yes, I'm Natasha. I've been here for almost 6 years. I run groups like Ashley does, and I also do a lot of one-on-one meetings as well. We also have a volunteer program here at the Council on Aging, a lot of interest in that lately. And we're also both Shine counselors of the state, which means we do health insurance counseling.
Thank you. Thank you. Christopher, do you want to introduce yourself?
Yes. My name is Chris Kabalowski, and I'm the Health and Wellness Coordinator for the Somerville Council on Aging. I've been with the council for about over 7 years now, and I coordinate and oversee all the health and wellness programs that we do. I run the Fit for Life exercise program, but we have the health fair, nutrition fair, so anything health and wellness I kind of oversee and coordinate.
Thank you. Debbie, do you want to talk a little bit about yourself?
Hi, I'm Debbie Higgins. I've been with the Council on Aging for closing in on 4 years, been with the City of Somerville for 20. I am the outreach coordinator. So I kind of like to think I'm sort of like the little party planner. We try to pull in fun events, get presenters, performers, create new activities, along with doing our social media groups, Google, email. I'm very impressed at how tech savvy the seniors are, along with our newsletter, Living the Good Life and stuff. So really just trying to get all our COA information out to our seniors any way we can.
Thank you. Now we'll go into the questions, but the first question I wanted to answer was, the biggest question we get is, are you still working? Can you still help us? And that's our number one question. You see all the heads bobbing. Yes, we are. We're definitely still working. I think because we're constituent based, we're one of the few departments that really is out there in the forefront, and our faces in the community all the time, talking, delivering food, answering questions, doing all kinds of different things. But I'm going to start with Christopher, and I'm going to put you on the spot first, Chris. So we keep hearing that older adults and people with chronic conditions are at higher risk. Why is this so, that this is the age group that it's hitting?
Yes, it's a really good question, and I hear about that one a lot, and I hear it everywhere. So one of the key reasons because of that is, as we age, our immune systems tend to get a little bit weaker as we age. It's a normal process in life, and it has to do with the white blood cells in our body. And the white blood cells are the part of our body, the cells in our body that help fight infections and anything that kind of invades the body. So what happens is the T cells in our body, we don't have less white blood cells. The function just becomes a little bit weaker as we age, and because of that, we're more older adults are more susceptible to, viruses, infections, and getting sick. So it has to do with our immune systems. Now, with that, as we age, this is not everybody, but we tend to get, a lot of people tend to have a lot of chronic diseases, health issues, and that kind of adds to it as well. So there's a kind of a combination, but if you have high blood pressure, anything that might, I'm trying to think of anything else. Diabetes, obesity, these things, our bodies just don't function quite as well as they used to when we were younger, but it has to do with the immune system getting a little bit weaker as we age.
Thank you. Thank you. Ashley, I'll ask you the next question. We received many questions about preparation. Sue asked, I'm worried about what will happen if I get the coronavirus, and how can I prepare?
Just like Chris mentioned, we've been getting these types of questions a lot of how we prepare. And I think it's really difficult for people because we're seeing every day on the news and in the newspaper from our family and friends that the virus is affecting us in different ways. So it can be easy for us to say, I don't have to prepare, that it will only affect me a little bit or a mild case. But we talk a lot about in caregivers groups and the different groups of how we prepare as we age. And the answer really is the same. I like to say there's 4 main questions in preparing as we get older, and really preparing as we become more independent. So the first question I like to think about is, who will take care of my house when I'm sick? Who will pay my bills? Who will I give my password to, my bank account to, so that they can help me? The next thing is, who will take care of the people that I take care of? So if it's children or pets or parents or spouses, who can I ask to take care of them when I'm away? Because sometimes when you're in the hospital or not feeling well, you can't do it on your own. So after that, I think of who will take care of me if I get sick? Who will make decisions for me if I'm in the hospital and can't make the decisions on my own? That's commonly known as a healthcare proxy that you can talk about with your doctor. And then who will help take care of me when I get home? So who will give me a ride home from the hospital? Who will get my medications for me? Who will get food for me? And like I said before, it's kind of easy to think, I can get my own medications. I can drive myself home. But in order to prepare and to have your family and your friends and kind of alleviate the feelings of kind of making them say, I don't want to burden anyone, it's a good 4 questions to think about in preparing of how we can care for ourselves at any time.
And even asking those questions about, who make my healthcare decisions if I can't speak for myself. I think that's a really big one. Do you want to talk a minute about that? What a healthcare proxy does?
Absolutely. So a healthcare proxy in Massachusetts is a document that you can get online, the Massachusetts Healthcare Proxy, and very commonly you can get it from your doctor's office or a hospital that you go to. And it means that you've elected somebody while things are going very well, while you're very healthy and you're able to make decisions on your own. And you select a person, it can be anybody over the age of 18, to make the decisions if you're not able to. So I always give the reference or the example of in surgery. When you're preparing for surgery, you're making your own medical decisions. When you get out of surgery, you're making your own medical decisions. But in that meantime, when you're under anesthesia or you're in surgery and the doctor has a question, that's when your healthcare proxy can make the decisions for you. So it's only when you're not able to. It's a really good thing for everybody who's over 18 to have in their medical record or in their house.
And even though it may not ever get used, it's an important paper to have just in case. And we never know. At the senior center, people are always saying to us, why do you need my information? Because if you pass out, if you faint, if something happens and you can't speak for yourself, we need to know who can speak on your behalf. You know, it's a fact of life. Things happen all the time. So we need to just be cautious and careful. And I think the healthcare proxy is one form that really needs to happen.
Absolutely.
So let's go to Natasha. Let's talk about what about if you're feeling really anxious? And I know this is happening a lot. Connie and I had a conversation before we came on the call about how many people really are feeling anxious, and you know, you start your day off and you're like, what the heck's going on here?
Hey, a lot of uncertainty right now. So anxiety, especially now, is a very common feeling. You're not the only one who's feeling it. Many of us are very fearful of the future, the unknown, what's going on right now, what's going to happen to me, my family and friends. So it's very common. It's very understandable. Every part of our lives right now has been affected. The way we shop, the way we socialize, the way we go out, and things like that. It's, you know, just everything is affected. So a good way to sort of, you know, calm down, that's quick, easy, and just, you know, really helpful is take a deep breath sometimes, sit down somewhere, and, you know, really engage in meditation. Meditation's, you know, a nice way to sort of calm down, take a breath, and be mindful for the moment. Because we all have moments in the day where, you know, everything is just feels out of control. But with meditation, you can feel we're back in control. And so it's another really helpful way if you're feeling anxious, you know, call a friend. Not the only person feeling that way. Call a friend, you know, and say, you know, it's hard for me to really engage with, you know, my new reality, you know. And I think reaching out to other people, doing meditation, I think it's a good way to sort of combat that anxiety.
And that's true because we are feeling all that uproar in our system. You know, you listen to the news, you listen to TV, there's just everybody's doom and gloom, and the world, you know, it just is not a happy place anymore. And I think bringing yourself back to that happy place, wherever that can be, and however you can get to it, is such an important role. Thank you.
One more thing, I'm sorry. If you're
Yep,
feeling
no, go right ahead.
really anxious and like just meditation's not helping, calling friends not helping, talk to your doctor and think about seeing a therapist, a mental health counselor, to really talk over those feelings. You know, telehealth is still a thing right now. People are still able to get mental health care that they need. So don't feel afraid to reach out to your doctor and just talk about that.
And it is important, and even reaching out to any of us, you know, Natasha and Ashley are here and available. We're all here. We're all here for you. And we want to make sure that you are reaching out and talking to somebody. We'll talk a little bit about another program that you have in a minute, but I'm going to switch over to Debbie really quick. Debbie, recently we have begun to hear discussions about opening the country. But that being said, will we go back to normal? I don't know about that. We've seen many questions about what our new normal will be.
It changes daily is what the new normal is. So what we think today, tomorrow might be something else. So we are listening to all the guidelines that are out there. We're, you know, already making plans on how we can bring programming back safely. It's probably going to look a lot different than it did back in January and February. But believe me, we want to see you. We want to have lunch with you and do bingo. Well, I don't want to do bingo, but bingo. But we want to make sure everybody is safe. So you got to bear with us, and we're learning just with you. So we're going to make it enjoyable, but it's just going to be a different enjoyable.
It certainly will. And coming back, we really don't know whether or not we are coming back as groups again, or will we be wearing masks at the senior center? Are we going to be numbered in how many we have? Is there going to be 10 people, 15 people? It is so uncertain. And, you know, we talking a little bit about being anxious. I think we're all anxious as well about where do we go from here? How do we help direct? You know, we need guidance as well. And it's been pretty uncertain times for us. And even, you know, we're talking twice a week on conference calls, but still we're trying to figure out what is our new norm actually going to look like?
Right.
you know, and that's really going to be totally different. Krista, I'm going to go back to you. Since we are at higher risk, what are some of the things that we could do to keep ourselves safe? And this question I've heard quite a bit, and I know you probably have too.
Yeah, no, this is a common question out there, and it's something that it's a good question to keep thinking about as this goes on. You know, as from the beginning, you know, it's always good to listen and follow the health professional guidelines. So whatever's out there, the city, the government, you know, the stay-at-home order. You know, it's good to listen. It's good to stay up to date and follow the guidelines. So those guidelines right now, you know, we're under the stay-at-home order. You know, so if you can stay at home, we encourage everyone to stay at home. Now with that said, you know, you can still go out to a certain extent. But if you do have to go out, let's say you have to go get groceries, you have to go get a prescription, you know, it's good to follow procedures. So, you know, with that, you know, social distancing, you keep hearing about that. So you want to try to keep, you know, 6 feet or more away from people. If you go out, you want to make sure you're wearing some kind of face covering. It could be a mask or something that cover your mouth and nose. And then, you know, something to keep thinking about is good hygiene. So, you know, if you go out and you're coming back, make sure you wash your hands for 20 seconds. You know, make sure you clean the doorknobs at your apartment or house. Wash, you know, disinfect the remote, your cell phone, your keys. You know, so, you know, it's all I kind of consider simple things, you know, but follow the guidelines that have been put in place. And that's the most important part.
So speaking of masks, there's been a new order to do a face covering. And that is a question I've gotten the most since I'm manning the phone. And what's the difference between a mask and a face covering?
So, yes, a lot of people are getting a little confused. You know, a mask, this week we're handing out masks. I'm going to hold one up. This is a mask that we've been handing out. We're handing more out this week. But essentially, you know, it's something that goes over your mouth and nose. So hopefully you can still hear me, but I'm going to put it over my mouth, around my ears. And then, so this is a mask to pretty much cover up your mouth and nose. Now, face covering, sorry, glasses are in the way. Now, some people think you just have to wear a face covering like a mask, but the other thing is, that's right, I got a pink scarf here. It doesn't have to be a mask. It can be a scarf, anything that covers your mouth and nose. So scarves, this is my wife's, but these work these are amazing. As you can see, you can wear a scarf and you can put this, sorry, I'm not very good at this. You can put this over your mouth and nose. With a little bit of practice, it works pretty well, actually. But as you can see, I'm covering my mouth, my nose, and that really cuts down on any of the droplets, any of the particles from the viruses in the air. So that's the key to remember, is it doesn't have to be a mask. It just needs to be a face covering. So that can be an old t-shirt, a scarf. A lot of people are making homemade masks. You know, these are coming in really handy, and you're seeing a lot of these out. Same thing, goes around your ears. Now, one of the important key thing is, especially if you're wearing a mask, you want to try to get the seal around your nose and your upper cheeks. There's typically like a little metal bar, little metal piece that you can shape, and you can actually form that around your nose and over your cheeks. And that's one of the key parts if you have a mask. It also helps if you can get that seal around your nose and cheeks. If you can get that tighter, it helps with cutting down on fogging up your glasses. I've been fighting with that a lot lately. I put on a mask, but then I can't see. So, but try to get that seal as tight as you can, and that'll help cut down on the fog. And then one other thing, though, that is good to keep in mind, though, with either a face covering, a mask, or whatever it may be, you want to make sure you can keep breathing. That's a very good thing. You know, especially as we get older, our lungs tend to get a little bit weaker. So if you're wearing a mask and, you know, you're breathing and it's, you know, you need a break, you know, you can always step away and, you know, make sure you're getting good air into your lungs and everything. So it's important to keep the mask on and use it, but make sure you're breathing well as you're using it.
And one of the other questions was, do I need it in the car? If you're alone in the car, you don't need it. However, you should be cleaning the inside of your car, wiping it down, just like you do at home. And you can use just a little bit of alcohol or soap and water. Make sure you're washing the seatbelt, the stick shift, whatever, the console with any of the buttons you have to push, your lock, all that kind of stuff. So just in your immediate area, but especially the seatbelt. Nobody ever thinks about the seatbelt. So just wiping that off, a little soapy water, that's good. Now, Ashley, if I get, go ahead, I'm sorry.
One other thing I didn't mention is it's also important, try not to touch your face. I know I've done it a couple times in this meeting. I've itched my chin. It's really hard to do, but it's really important that, you know, try not, if you take off your glasses and rub your eyes, you know, try not to do that, especially if you're out in public. That's a very important thing.
Right. Ashley, I was going to say, now, if I get sick, should I just go to the hospital and present myself?
No, as always, if you're feeling sick, you should call your primary care doctor or one of your doctors on your healthcare team, because, you know, they know your medical history well, and they'll be able to talk to you, whether over video conference or right over the phone. They're working as well, and they'll be able to assess your symptoms and tell you if you should get tested, tell you if you should stay home or seek, you know, further medical care. So definitely your doctor should be your first call.
And Natasha, they're sitting home, you know, we just talked about being anxious and all that. What are some of the things they can do if they're home and just looking at the four walls? What are some programs that you have?
Yes, we have a friendly phone caller program here at the Somerville Council on Aging, where you pair up with another senior and you can talk about anything in the sun, you know, TV shows, movies, recipes. It's really a fun way to engage with other people while social distancing. The once-a-week phone call, low commitment, a lot of fun.
And you don't have to stop at just one person. And also letter writing campaigns. I think one of the things I love to do is, and my friends all love it, because I write little cards or little notes, or really we're back to basics.
Yes, we are.
Having a phone that we can see everybody, and thank God for FaceTime. We get to see my grandchildren and great-grandchildren. But letter writing, writing a card, just a simple thinking of you, how are you feeling, what's going on, you know? I think I read on the news the other day, or heard on the news the other day, rather, letter writing is up 100%.
Amazing.
People haven't been, I mean, how many snail mail? Not many, you know, occasionally a bill, but cards and all that. And Hallmark stores couldn't wait to get open to get their business again. And they were even sending out free cards to people. So that was what the conversation had started about. But, you know, writing notes is a great way. And the friendly phone call is a really pleasant way to have a conversation. I know as I answer the phones, I've been hearing people say, geez, if I didn't hear from Sue, or if I didn't hear from Karen, I don't know what I would do. It really makes my day, you know. And of course, we're all calling everybody. So that really, I'm hearing all the stories, folks. So they're calling me. Natasha's calling, Ash is calling, Debbie's calling. So it's great. Chris is calling. So thank you so much. Debbie, I wanted to ask you, when they lift the stay-at-home order, will we go right back to the Council on Aging? Is that going to happen on May 19th?
No. So just sit down. The cabs will not pick you up. But no one's coming to get you. So we don't even know what'll happen when you know, we may be staggered going back into the office. So it's something that we're going to be working on. As much as we'd love to, have you run right in and, serve you an awesome lunch, it's not going to happen right away. But believe me, you will be the first to know when we can let you all back in the door. Again, it's still a plan that we all have to work on. Again, we all keep saying the new norm. We really don't know what the new norm is. So again, we have a lot of safety procedures and things we want to clarify, and again, to get you all in safely. So bear with us. As much as we miss you, we all miss each other. It may just take us a little bit longer to get you guys back in the building, but we'll let you back in.
Eventually. I want you to be the bad guy. I can't tell you every day I get a phone call. So May 18th, the order's lifted. So does that mean we're coming back on May 19th? Then I just keep saying we gotta wait and see. Gotta wait and see with the governor. But we are waiting for what the governor has to say. He has a big decision coming up next Monday about whether or not the state will be open, how the state will be open, what will happen. We're waiting for guidance from our mayor, Joe Cototoni. We're having a town hall meeting tomorrow with the mayor tomorrow night. We hope that you'll all join us in that, and we'll have some more information. But we need to make sure that we keep the most vulnerable population as safe as possible. I'm going to go around robin, and I want you to tell me one thing that you're doing that is positive that's in your job that we've been able to turn into something on YouTube or video or TV or whatever. Ashley, I'm going to start with you.
Sure. We've recently received a grant called Living Your Best. It's on the power of resiliency and staying strong through tough times. And we've been able to incorporate that on our Facebook, Google group. We had music therapists do programs on our YouTube channel and cable access. So we've really been able to incorporate that well into our new normal of video conferencing.
And Steve Gintz has been doing great programs with the Memory Cafe. So that's really great. We're really happy about that. Debbie, you're really booming. What do you have going?
Well, with the thanks of, help from Chris and Natasha and Ashley with all of the fun exercise daily posts, social things, Facebook and the Google group, I'm doing more emails and responses with the seniors, and they're actually having a blast because then they're sending me back, telling me, hey, this is what I'm doing at home. You should try this. So I'm impressed at how these seniors are reacting with social media and emails. It's actually a lot of fun. So I think it's something that when we go back to the center, I still think that media piece is going to be great for them also.
And if they want to sign up for Google Group because they haven't, how are they going to do that?
They can send me an email right at dhiggins, Higgins, at Somerville, ma.gov, and I'll put you right on.
Awesome. And Ashley, give us an extension on how people can reach you.
Sure. They can call my regular phone number at 617-625-6600, extension 2318.
And if they want to reach you by email?
Oh, it's the same as Debbie's. So it's the first letter of my first name, A, and then my last name, Spiliotis, which is SPELIOTIS at somervillema.gov.
Great. Chris, you're next.
The few things that we've been doing is we've been trying to post as many exercise videos as we can on YouTube and on the Somerville cable channel, and those are playing daily on the cable channel, the local cable channel. And then also, like Debbie has mentioned, we're trying to get posts out. So every morning we try to write a healthy tip and a daily exercise. So hopefully they're useful. We've heard a lot of positive, good things about them, but those are the two things. Just because we're not in the center, we're still we're still exercising. We're still trying to get information out there.
I think they're all complaining I'm making them work twice as hard. Natasha, you're up.
Yes, I think that I've gotten so much positive feedback from the Friendly Phone Caller program. We've had people who have never met in real life connect over food, family, fun, memories, music. It's been really fun to hear the results. I've really enjoyed it.
Thank you. Thank you all today for joining us in Ashley, Debbie, Chris, Natasha. Thank you for all these questions. We do get a lot of questions. We want you to keep up with this. We will try to do this one more time before we come back. But until we see you, be safe, Be well. Keep your face covered. It doesn't mean a mask. It just means anything, a little bandana, cut the back of a t-shirt, cover your face. If you're not well, as we said today, call the doctor. Don't rush into the hospital. And we do hope we'll see you real soon. Until next month, be safe, be well. We'll talk to you soon.